Fibromyalgia is a chronic condition characterized by widespread musculoskeletal pain, fatigue, and tenderness in localized areas. It is a complex disorder that affects how the brain and spinal cord process pain signals. The exact cause of fibromyalgia is not well understood, but it is believed to involve a combination of genetic, environmental, and neurological factors. Symptoms: the primary symptoms of fibromyalgia include widespread pain, persistent pain throughout the body, often described as a dull ache. The pain is usually felt on both sides of the body and above and below the waist. Fatigue, chronic tiredness that does not improve with rest. People with fibromyalgia often report feeling exhausted despite getting enough sleep. Sleep disturbances, problems with sleeping, including difficulty falling asleep, frequent waking, or feeling unrefreshed upon waking. Cognitive difficulties, often referred to as fibrofog, which includes problems with concentration, memory, and mental clarity. Tender points, specific areas of the body that are particularly sensitive to touch. These tender points are located in areas such as the neck, shoulders, back, and hips. Other symptoms: headaches, irritable bowel syndrome IBS, temporomandibular joint disorders TMJ, and mood disorders such as depression or anxiety. Causes and risk factors: the exact cause of fibromyalgia is not known, but several factors may contribute. Genetics: fibromyalgia tends to run in families, suggesting a genetic predisposition. Infections: some infections or illnesses may trigger or worsen fibromyalgia symptoms. Physical or emotional trauma. Stressful events, such as physical trauma or emotional stress, can sometimes trigger fibromyalgia. Abnormal pain processing. There is evidence that fibromyalgia may involve abnormalities in how the brain and spinal cord process pain signals. Other conditions. Fibromyalgia often coexists with other conditions such as rheumatoid arthritis, lupus, or chronic fatigue syndrome. Diagnosis: there is no specific test for fibromyalgia. Diagnosis is based on medical history and symptoms. A thorough discussion of symptoms, medical history, and any potential triggers or related conditions. Physical examination. Identifying tender points and assessing pain levels and distribution. Exclusion of other conditions. Ruling out other conditions that may have similar symptoms through blood tests, imaging studies, or other diagnostic procedures. Treatment for fibromyalgia aims to manage symptoms and improve quality of life. It often involves a multidisciplinary approach. Medications. Pain relievers, over-the-counter options like acetaminophen or ibuprofen. Antidepressants. Medications such as duloxetine, Cymbalta, or milnacipran Savella can help with pain and fatigue. Anti-seizure drugs, gabapentin, Neurontin, or pregabalin Lyrica can be effective for nerve pain. Lifestyle changes. Exercise. Regular low-impact exercise, such as walking, swimming, or stretching, can help reduce symptoms and improve function. Sleep hygiene. Improving sleep habits and managing sleep disorders. Therapies. Cognitive behavioral therapies (CBT) can help manage the psychological impact of fibromyalgia. Physical therapy, tailored exercise programs, and manual therapy. Complementary treatments. Acupuncture may provide relief for some individuals. Massage therapy can help with muscle tension and pain. Yoga and relaxation techniques, stress reduction techniques, such as mindfulness and meditation, can be beneficial. Self-care and stress management. Developing strategies to manage stress and balance activities to prevent overexertion. When to seek medical attention: consult healthcare provider if symptoms persist or worsen, despite treatment efforts. New or severe symptoms develop, such as significant changes in cognitive function or mobility. Coexisting conditions. If you experience symptoms that might suggest another underlying condition, Conclusion: fibromyalgia is a challenging condition that affects many aspects of life. While there is no cure, various treatments and strategies can help manage symptoms and improve quality of life. Working closely with a healthcare provider to create a personalized treatment plan is essential for effective management of fibromyalgia.